Okay guys, I have Marianne here, and she's here. We're actually going to be doing surgery shortly, a couple days, and she has quite a bit of nerve pain from the knee down. Some would call it almost like neuropathy symptoms, but she also has symptoms from the knee up, which we would call sciatic pain. And one thing I want to mention to you, we do see people, we oftentimes do surgeries on nerves from the knee down to help with restless legs, to help with neuropathy, maybe to help with drop foot. But the specific nerve I'm going to talk to you about today with her is called the common peroneal nerve, and it's right here. And there's a new technique that we use to evaluate people to see if this nerve branch has an effect on the sciatic nerve pain, because we have sciatic nerve pain that's coming off the back, going down the buttock, and then it kind of comes down this way and can go on further down into the top of her foot. There's a branch right here. It's called the common peroneal nerve. And to see if this is implicated with pain up above it, we can sometimes do an injection. And it has a name now. It's called the Phoenix phenomena. What we do is we make an injection right here. There's a nerve tone here called the common peroneal nerve. And we put some local anesthetic there. And we use an ultrasound machine. That's an ultrasound machine. To make sure we put just a small amount in the right area. What happened to the pain up above your knee when that happened?
It disappeared.
It just went away.
And there was more pain that was in the background that I didn't realize was there until I got that injection.
So that was gone.
It was gone. And
for a few hours.
For a few hours. And then when that injection wore off,
bam,
it went full-blown sciatica for about 4 or 5 days. It was horrible.
Right. So you can tell. So what I'm trying to say, we will be doing surgery on this, and the initial intent for this nerve surgery was to help, because it feeds into the top of the foot, to help with a lot of the nerve symptoms here. But when we did it, it gives us more confidence, and Marianne's confidence, that this is probably implicated up there. It's called the double crush theory for people that may not heard of this. If you have compression here and you have compression in the back, and you've had an MRI, right?
Yes, I have a moderate herniated disc.
Moderate herniated disc. Doctor isn't necessarily recommending surgery, but there is probably compression in the low back. If there's compression there and there's compression here, double crush theory states that if you open this up, there will still be compression in your back. You can do an MRI, it still exists. However, that nerve now isn't as sensitive to it. So it can help with sciatic pain, and we've even seen it help with back pain. So something you need to realize if you're watching this video, that your sciatic pain isn't always from the back. And that's the thing you're going to hear mostly in medicine today. It's the back over and over. But you're not hearing about this nerve, common peroneal nerve. So it's another option you have. And if you're out there and you're listening, and maybe you've even had surgery in your back that didn't help your sciatic pain, maybe this could be part of the problem, and it's something to look at. Wherever you are, consider seeing a peripheral nerve surgeon like myself. But I really appreciate you sharing this information, because I think it's really useful, and hardly anybody knows it. Hey, they really don't. We were just discussing,
I almost came back
why don't more people know about this? And, okay. But anyway, we really appreciate you sharing that information with us today, Marianne. And if you're new to YouTube, please consider going to Facebook. We have a Facebook videos in there on Facebook, and subscribe there, and to our YouTube channel. I think we're almost up to 7,000 YouTube subscribers. So thank you for your support, and make comments if you can. That'd be great. Thank you.